Hey, my name is Josh Smith. I'm the president of Montana Knife Company, and I'm here today with Tier CIMAC. We have our Montana Knife Company IFAK. This is an emergency medical kit. It's kind of the basis of what you need to go in the field while you're hunting or hiking, doing any kind of outdoor activity. And so today we're going to be breaking down an individual piece of this and really getting in some in-depth knowledge from Tier. And so we're going to be covering our tourniquet today. Tier, tell us about the type of tourniquet that you're using, and let's see a little demonstration on how it works.
So this is a Special Operations Forces tactical tourniquet. The components are, we have a strap, and we've got a windlass, which is a fancy Scandinavian word for stick. And we have a way to secure said stick. The mechanism of any tourniquet is to apply pressure to the artery against the bone. It's just like kinking a hose. In order to properly apply this one-handed, we're going to draw out our tourniquet, put our thumb to the buckle, place it on the affected limb, grasp near the buckle, and pull violently. And just like shampooing, rinse and repeat. Once that is cinched, and it's very critical, Josh, that this is actually cinched up against the skin. You don't want any slack in here before you start turning. Grab the windlass, pull out, and start twisting. And you keep twisting until the bright red bleeding stops. Once that's done, you secure there, and voila.
Okay.
Save the day.
So talk to me about why you, and what thought process you need to have when you're going to put that on your arm. I've seen some people put those on where they have to then push that strap away from themselves.
Right.
Talk about actually putting it on kind of from the start there.
So a common fault, if you don't start with your thumb to the buckle, you can do what you're describing. Let me undo this and I'll just demonstrate. You can end up putting it on with the strap facing away from the body. And you can still apply an effective tourniquet this way, but ergonomically it's very difficult.
Well, and speed is of the essence, time is of the essence here, so.
That's right. With tourniquets, if you ain't first, you're last. So it still works, but it's more difficult to put on. Mm-hmm. And when you're losing blood and your monkey brain is taking over in a stressful environment, it just makes things more difficult, and you're more likely to make a mistake.
Now, when you pack this in your kit, would you pre-size it? You know, obviously you're not going to know if you're putting it on your leg or your arm. Are you better off to pre-size it for your leg because your leg is bigger? Unless you have arms like mine. Generally, my arms tend to run a little oversized. So are you
with your head?
Yeah, yeah. Are you able to? Should you pre-size that to like the biggest part of your body that you're going to put that on?
No. So, and that's a great question. You want to pre-size this to the limb that you would have to use one hand with. When we talk about putting this on a leg, typically we'll be able to use both of our hands. We assume we'll be able to use both of our hands, which makes this easier to adjust and take apart. But if we have to use it on a limb, an upper limb, our arm, whether it's left or right, we're going to end up using that one-handed. So we take as much slack as we can out of that loop for efficiency, but we also want to keep that loop big enough that we can get it over any loose clothing or equipment that we have. When we're placing this, we want to make sure it's off the joint, either well above or well below a joint, and not up, that includes shoulders. So about midway in between there.
How far from the wound should it be?
Kind of the same. When you tighten this down, it's going to work its way into the path of least resistance. Mm-hmm. So if you've got an open wound on your upper arm, you don't want to put the tourniquet right next to it because eventually it's just going to slide into the wound. So you want about 2 inches or 2 fingers above or below a wound. We don't want it. Let's edit that. About 2 fingers above the wound, okay. Minimum. We don't want it 2 fingers below the wound. That's a little counterproductive.
Yeah. So should you write down a time or make a note in your phone? What is, you know, you hear different things. I've seen different things on the internet about like, well, you can't have a tourniquet on too long. You're going to lose your hand or your arm.
Right.
What's the deal there? Should you loosen it halfway through on the way to the hospital? Things like that. So
for you, the layperson, the non-medical provider, placing a tourniquet on, once you've got it on there, leave it on there. The caveat to that is if you're in wilderness medicine and you're finding yourself out by yourself or away from advanced medical care for an extended period of time. And when I say extended period of time, I mean over half a day to days. That's when you would do some extra work there. But in general, for the layperson or the first responder, if you put this on, leave it on. Let somebody else deal with it. There is a common myth that's still floating around in there in some of the older schools of thought that once you put a tourniquet on, you're going to lose that limb. Completely debunked. Completely debunked. You know, we've had combat operations going on for 20 plus years now, and lots of service members have had tourniquets on that are not missing limbs. The record right now, as far as I know, for having a tourniquet in place and making a 100% recovery is 6 hours.
Okay. So when you have that on, if you put that on your buddy, there's a really good chance he's going to immediately start complaining that it hurts like hell.
If this is working, it's painful.
Yeah.
It's painful. And the reason for that is because nerves run next to arteries. So if you're compressing the artery, you're also compressing the nerve against the bone, and that is painful.
So if it's on your child, if it's on your wife or your buddy, and they're complaining about the pain, you got to take this thing off. If it's actually a situation where you needed it, they're going to have to just deal with the pain.
That's right. That's right.
Now, how do you know if you actually need that? Because, you know, there's a lot of injuries that you can have where there's a lot of blood.
Right.
Especially for someone who's, you know, not been in the line of work that you've been in. You know, somebody can just see a lot of blood and think that they need a tourniquet. Right.
So for extremities, I like to preach this. When in doubt, whip it out. If you've got to debate whether or not to use a tourniquet, you should just use the tourniquet. You can reassess later as to whether or not it's actually needed. But if you've got bleeding that is uncontrolled, we call that massive hemorrhage. It doesn't matter if it's arterial or venous. If it's uncontrolled hemorrhage and you've already tried compressing it, direct pressure, using gauze, whatever, then definitely go with this. Now, that's not to say that you should try to throw gauze at it first. If that thing is pulsing or squirting or soaking clothing, those are all signs of arterial hemorrhage, and you should go with this right off the bat.
Now, with that being said, can you use that tourniquet to initially help stop bleeding, then clean up a wound, pack it, bandage it up, and then potentially release that and see if that bleeding stops?
Yes, you can. And I know that goes a little bit against what I was just saying, but I mean, there's a big caveat to that. If you discover that, and it's a judgment call, but if you discover that it really was a smaller laceration, you can see the source of the bleeding, then yes, you can definitely convert this to a pressure dressing.
Okay, and then take that off. And there again, you take that thing off and you start to see a bunch of blood coming out through that wound packing that you did. Obviously at that point, get that tourniquet back on.
Right, and when we say take it off, we don't actually take it off, we just loosen it. And we loosen it one turn at a time.
And I will say, in some of the trainings that I've been a part of with you, one turn can mean the difference between bleeding and not bleeding. Yeah. It's actually, it's interesting how just that last turn is the actual kink in the hose.
So think of that's exactly what I was going to say. It's a kink in the hose. So if you think about this, and don't think of it like an artery, think of it like a garden hose, except your garden hose is pumping life-saving fluid. If you've got that garden hose, really what you're doing with this tourniquet is you're kinking it.
Okay, so last thing, tourniquet selection. We absolutely believe that you should probably have 2 tourniquets in your kit. However, when I was putting these together and thinking about this, I'm trying to get people like my friends that I used to work with, guys that I hunt with, to carry just even some level of care in their pack. Because basically, other than maybe potentially a Band-Aid and some leftover drugs from their back surgery, that's about all they're carrying. So 1 tourniquet is clearly obviously better than none. But guys like Tier would definitely argue that 2 is 1 and 1 is none. So if you're gonna go out and buy another tourniquet to actually have 2 tourniquets in here like you probably should have, what is it that you're looking for in a tourniquet if they're online looking?
I'm looking for a reputable brand. I avoid buying from online marketplaces like Amazon because there's a lot of knockoff and imitation tourniquets there. It's better to buy directly from the manufacturer. Like this one is TAC Med Solutions, or CAT is North American Rescue, or a reputable company like Fieldcraft Survival, which sells both of them. And if you're going to buy online, buy either from the manufacturer or from a medical supply company. Don't buy off Amazon.
Okay. And the last piece of that with, for example, a Fieldcraft Survival is they offer training courses. I know Tier's done a lot of training courses. If you want to get more in depth on a lot of this stuff, go take a class. There's a lot of these, special forces medics, corpsmen, different guys who have retired and they're out there teaching these classes. So, look at a Fieldcraft Survival's website, see what their training schedule is. They're doing them all over the country. I know Tier, you have an Instagram, right? And you go around and also do some teaching.
That's right. Yep. I tailor medical classes to the specific clientele and what they're doing, and sometimes what their protocols allow as well, because there's definitely things that I can do overseas that I can't do here, not without going to jail. And people can find me on Instagram at redleader_standingby.
Okay. All right. Thanks, guys. That's our tourniquet portion of the training on this kit. We have some other videos on the other pieces that are in this kit. They really go together for a reason. There's other components to this kit, and then feel free to add things to your kit. If you need an EpiPen, for example, some of the survival stuff that you have that you want to add, make this a complete kit that fits your needs. If you have prescription medicine, stuff like that that you need, Band-Aids, there's some little things in there that we could have thrown in that I think are, they're kind of little luxury items. They're not necessarily absolutely necessary. This is just to get you to that next level of care, and it's the bare minimum. So fill up your kit with what you need, and good luck hunting.